Hey guys, I know I'm calling these episodes, and I know that in the last video I mentioned like episodes and that I didn't want to make them long, and so I don't want you to think that every one of these is going to be long because I'm trying not to make it so. But I want to put as much information in these videos as I can to help people out. Being a breastfeeding peer counselor, I love the knowledge that I have obtained from the classes that I went to, and not only that, as I've mentioned in another video, the knowledge that I've gotten from actually breastfeeding my son for the year that I breastfed him. Some things that I want to talk about right now are some complications with breastfeeding that that I have dealt with myself, and I know some people, whenever I was working as a breastfeeding peer counselor, that they had these issues. One big issue that comes to mind is thrush. When you have thrush, your baby has thrush in their mouth, one thing is, I know it's uncomfortable, and the baby's uncomfortable, but breastfeeding through it. And it's not ideal because you feel uncomfortable, there's the itching, there's the burning, and it doesn't stop. And then the baby, of course, will have what looks a white substance that will come back even when you clean off the tongue and that kind of thing. And of course, you'll notice thrush issues whenever the baby just doesn't want to latch, and they've normally just latched fine. You know, and there's other ways, there's other things too where you can figure out that it's thrush. I mean, I could talk about that. I could talk about thrush for forever. So that's something to look into, because that's a possibility that it could happen. But I can tell you some things. There's a thing called gentian violet. Now, it's one of the remedies that you can use for thrush, along with if you use a nipple shield, you know, just sanitizing the nipple shield and that kind of thing. Gentian violet will make your breast purple. It'll make whatever it touches purple, and it'll just kind of stain it. So I always, whenever I would put gentian violet on me, I'd make sure that I wasn't like wearing any clothes or any bra or undershirt that I really liked, because it stains them. But it helps. It's very helpful with thrush. That's one of the things that I used. And then just continuing to breastfeed through it, though, you know, it's because ultimately you know that breastfeeding is best for baby. Otherwise you wouldn't be doing it. One other complication that some of my clients had was a thing called mastitis, and it is where the breast feels very warm, feverish, like, and it has red spots on it. That is something that can cause concerns, and it's also something that I do not mind talking to people at all about, and I hope that y'all will comment on these videos, some questions that you have, some concerns, or actually some help for anybody else that's breastfeeding that you have learned, you know, some tips and things like that. I personally didn't have mastitis. I did have issues with my nipples they actually cracked, and that was painful. But what I did when it came to that was I honestly put some breast milk on it, and, you know, just kept breastfeeding through the pain. I had some other difficulties. One of the biggest difficulties that I had was engorgement and clogged milk ducts. And engorgement, I want to make another video just about engorgement, so y'all hold tight too about that. But clogged ducts, this is the last topic that I'm going to talk about, and then I'm going to end this video. But clogged ducts, basically those are, you can kind of feel like a lump whenever you, but it's not a lump like, you know, breast cancer kind of lump, but, and it's so funny because one time when I had a clogged duct, my son was nursing, and all of a sudden, he unclogged it, and I could tell, and the milk just spewed out, and he slings his head back. It was very funny, but, clogged ducts can be very painful, and the thing that people don't know is all of the places that the milk ducts are in the breast. That's something that unfortunately I don't have like a picture to put into the video to show you, but there's lots of milk ducts that are in our breasts. There's plenty of them. And I know that we try to think that at the nipple is where babies should be. And I'm going to talk in another episode about latch a little bit, helping you out with that it's not nipple feeding, it's breastfeeding for a reason. So I hope that you guys will stay tuned, because I've got plenty of things to talk about breastfeeding. And if you have any questions, again, please comment below. Thank you so much. I know this was another long one, but I hope that you guys will stay tuned for more of my videos about breastfeeding and birth. I can even talk about birth. Ask some questions about that. If I don't know it, I'll find the answer. Thank you guys so much. Y'all have a great day.